Have you ever noticed that some people get really nervous or anxious around men? Maybe you've felt it yourself or seen it happen to someone close to you. It's more common than you might think, and it actually has a name: androphobia. Androphobia is the intense fear of men. I'm not just talking about feeling a little awkward in a group of guys or being nervous before a first date. This is a real, overwhelming fear that can make everyday situations feel impossible. For some people, just seeing a man, hearing a man's voice, or even thinking about interacting with men can trigger panic. So, what does androphobia look like? Well, the symptoms can show up both in your mind and your body. You might feel your heart racing, your palms sweating, maybe even shaking or feeling dizzy. Some people experience shortness of breath, nausea, or a strong urge to run away. There can also be emotional symptoms, like feeling dread, embarrassment, or even shame for having these reactions. Androphobia can make it hard to trust, to form relationships, or to function at work or school if men are around. But why does this happen? Like most phobias, androphobia often starts with a negative or traumatic experience involving men. Sometimes it's because of childhood bullying, abuse, or witnessing violence. Other times it just develops over time with no single clear cause. Our brains are wired to protect us, but sometimes they go into overdrive and see danger where there isn't any. Now, here's the good news. Androphobia is treatable. If you or someone you care about is struggling, you're not alone and help is out there. One of the most effective treatments is therapy, especially cognitive behavioral therapy, or CBT for short. This type of therapy helps you challenge the thoughts that fuel your fear and teaches you new ways to cope. Gradual exposure is another helpful approach, where you slowly and safely face your fear of men in small steps, building confidence along the way. Sometimes, therapists might use relaxation techniques like deep breathing or mindfulness to help manage the physical symptoms. In some cases, medication can also help, especially if anxiety is severe. Remember, there's no shame in having a phobia. You deserve support and understanding, just like anyone else. Facing your fears takes courage, but it's possible, one step at a time. If you're struggling, consider reaching out to a mental health professional. There's hope, and healing is possible.